Today we're going to talk about a really important topic. We're going to talk about estrogen dominance. Hormones is such a powerful topic. It's something I work with my patients with all the time because our hormones really have such a major role in how we feel. First of all, what is estrogen dominance? It means that estrogen is dominating and among the hormones. Kind of like all our hormones are like a symphony. And so if you go to the symphony and you've got the string section and the percussion section and the woodwind section, and say the percussion section is out of beat, it's going to throw everything off. The same thing with the hormones. If your estrogen is out of balance, or your progesterone is out of balance, or your testosterone, or your DHEA, your adrenals, your insulin, so on and so forth, it's going to mess things up because it's kind of like the symphony or like a spider web. And if one thing moves, everything moves with it and throws it out of whack. And so estrogen dominance sounds like it means there's too much estrogen, and that is what it means. But it doesn't necessarily mean you have a boatload of estrogen. It may just mean you have too much estrogen in relationship to a non-existent progesterone level. And so estrogen and progesterone really are closely connected. It's a relative level. And so estrogen dominance can be because, yes, you have way too much estrogen. It could be maybe you have a tiny bit of estrogen, but in relationship to your progesterone, where you have none, now you have too much estrogen. When you have estrogen dominance, there is too much estrogen. It's unopposed by progesterone, and it's causing problems in your body. And so what are the symptoms of estrogen dominance? There are so many. And so I'll tell you a few, from serious conditions such as breast cancer or uterine cancer, to allergies, accelerated aging, fibroids, uterine fibroids, endometriosis, headaches, weight gain, dry eyes, hair loss, cervical dysplasia, irregular menses, gallbladder disease, depression, anxiety, premenstrual disease, and I could go on, but I think you get the gist. There's a lot of things that can be happening in your body, fibrocystic breast disease, that can be caused by estrogen dominance. And so where does this excess estrogen come from? And it comes from a number of places, but the truth is everyone to some degree has estrogen excess because we are, as one of my old mentors said, we're swimming in a sea of estrogen. And he said this to me like probably 15 years ago, and it's only gotten exponentially worse with what we're being exposed to and the modern day and age. And so it comes from our meats. If you're not eating hormone-free meats, the farmers are using the estrogen to plump up the chicken breasts and to plump up the meat, and so you're getting it in the meats. So really important, grass-fed and finished organic, make sure your meats are hormone-free. It's coming from soaps and personal body care items. It's coming from car exhaust. It's coming from the carpets. It's coming from plastics. It's coming from pesticides that are being sprayed, industrial waste products. It's coming from the parabens, the phthalates, the benzophenones, which are in sunscreens, the water we're drinking. If you're not having a really good water system that's activated charcoal and ceramic and reverse osmosis and filtering your water, you can be getting estrogenic tendencies there. It's really important to be very mindful of what you're putting into your body and on your body. And so those are some of the external ways we get excess estrogen, and I want to talk a little bit about the internal. And so some of these things have to do with how your bowels are moving, because estrogen goes through the bowels, and if your bowels are slow and your transit time is slow and you're not having frequent bowel movements, then the estrogen is hanging around longer and it has the opportunity and it will be reabsorbed, and so you're getting like extra exposure to your own estrogens. And so making sure you're not constipated, making sure that you have the proper amount of stomach acid so that you are getting proper digestion and that your bowel movements and digestion from the beginning at the first start in the stomach are effective. If you are carrying around excess weight, then you can be producing too much estrogen. So looking at your BMI, I believe a BMI of about 28% really contributes to having excess estrogen in the body. And so the fat cells will produce estrogen. Estrogen is mainly produced, we know, by the ovaries, but there's also been studies showing that estrogen is also produced in the hypothalamus. It's produced by the adrenal glands, and it's produced in fat cells. And so looking at your weight and making sure it's a healthy weight and you're not carrying around excess weight can really help with estrogen dominance as well. And I have women in my practice who are not carrying around excess weight and they still have estrogen dominance. So it's not the only reason. So just if you're not carrying around excess weight, don't think that, oh, well, I don't have an issue, because you still could, but it's definitely one of the contributing factors. Stress. And I always talk about stress because it's 99.9999% an issue with all disease as far as I'm concerned, in my humble opinion. And so what happens with the hormones, if we're stressed out, so pregnenolone is like a precursor, not like a precursor, it is a precursor for our hormones. But if we are stressed out, something happens that we call the pregnenolone steal. And so the pregnenolone will, instead of going and down the pathway and making progesterone, which I mentioned in the beginning, we need to balance the excess estrogen, it will be stolen and create cortisol, which is our stress hormone. So modulating your stress levels has a direct effect on your hormone balance. How does estrogen get out of the body? So I want to just talk briefly about liver detoxification, because it is really important that we support our liver when we are balancing our hormones. I use a lot of bioidentical hormones in my practice with patients, but I will not let them take those hormones unless they are on good liver support, good adrenal support, good drainage support for the body. So there's a lot that goes to the wise use of bioidentical hormones. And so you want to support your liver, because there's phase 1, phase 2, and there's actually phase 3, I like to think of, where toxins are going out through the bile. But in phase 1 of the liver, toxins come in and they go through a process, and so they're broken down so they can then get shuttled through phase 2 liver detoxification. And that's what I want to really focus on, because estrogen is really removed out of the body in phase 2 through, there's some sulfation pathways. Glucuronidation is a big one. And so with glucuronidation, there's this beta-glucuronide enzyme that is in the body, and it will take the estrogen and kind of break it out of the bond it's in that's excreting it out of the body. And when that happens, the estrogen gets reabsorbed and you get another pass. So taking something like calcium D-glucarate is an excellent supplement to prevent that from uncoupling, so that the estrogen, when it's in your body and it's being excreted, it stays together with its escort out of the body, and you don't get extra exposure to the estrogen. It's really about the balance. It's about the wise use, knowing about estrogen, doing all the lifestyle things so that your estrogen can be healthy. So what I do with patients is I do 24-hour urine testing, because I can actually look at the breakdown. There's 3 different estrogens. There's estrone, there's estradiol, and there's estriol. And estriol is a weaker estrogen, but it's actually very protective. It's thought to be breast cancer protective, and it doesn't have all the aggressiveness of estradiol, which can really cause proliferative actions in the body. And so I like to look and see what's really going on. We also have estrogen metabolites, and so some of these estrogen metabolites can be more beneficial than others. the 4-hydroxy and the 16-hydroxy metabolites are carcinogenic. We see a big correlation with excess 4-hydroxy metabolites of estrogen in breast cancer. And the 2-hydroxy ones are thought to be more protective. They're not as proliferative. And so a lot of times when a woman comes into my practice, or for those of you that are listening, you may be saying, yeah, I have breast tenderness, I have migraines, I have abdominal bloating, I have a history of fibroids, and so I must be estrogen dominant. And there's a very good chance you are. And so doing some of the things like reducing your stress levels, eating enough protein, because the pathways in the livers need protein, the sulfation pathway, you really need enough protein to make that run properly, making sure you have a good multivitamin. Sometimes you need extra B6. That's a common nutrient depleted if you have a history or are currently taking birth control pills, which I hope you aren't. And so all these things that you can do, taking calcium deglucurate, getting your gut flora balanced, supporting your liver with milk thistle and artichoke. Those are some of my favorites to help support the liver. All of these things you can do, and it may help. If you really want to know further, like I said, like 24-hour urine testing, working with a physician, because you can't really know how your estrogen is metabolizing unless you do some of these tests. It's really important to get that knowledge and know what's going on, because estrogen dominance, there, like I listed all those symptoms, and some are just, it's annoying to be a little bloated, but it can really lead to harmful diseases such as cancers and autoimmune disease. And so I'm not trying to scare you, but it is something that you really need to get a handle on. Like I said, there's many things you can do, such as helping to reduce your estrogen exposure. Sometimes you do need to take progesterone. Remember what I said in the beginning, it's a symphony, and there can be many reasons for estrogen dominance. And so you have to discover what they are for you. So changing the lifestyle, getting on a good supplement regime, making sure your bowels are moving, making sure your liver is moving. If you get your liver processing properly and you get your bowel excreting properly, you're going to have huge benefit as far as your hormones go. And so I hope you all have a great day. I will see you again soon, and stay healthy.